Introducing Ongentys, opicapone capsules, an early levodopa-carbidopa partner for off-time and Parkinson's disease. Ongentys is the first and only once-daily COMT inhibitor. As carbidopa inhibits the DDC enzyme, Ongentys inhibits the COMT enzyme in the periphery. This helps make more levodopa available to reach the brain. Ongentys is a unique molecule in COMT inhibition with prolonged pharmacological effect, allowing for once-daily dosing. Ongentys has maximal COMT inhibition at 84% that was maintained over 65% over a 24-hour dosing interval. Working in the periphery to inhibit the COMT enzyme, Ongentys decreases peak-to-trough variations of levodopa and increases levodopa exposure. Because more levodopa is available to reach the brain, Ongentys is thought to potentiate the effects of levodopa. With more levodopa available to cross the blood-brain barrier, it is thought that more of it may be converted into dopamine in the brain. Once-daily Ongentys can help protect levodopa from the COMT enzyme as part of your early levodopa-carbidopa adjustment strategy when off-time occurs in Parkinson's disease. Important information, indication and usage. Ongentys, opicapone capsules, is indicated as adjunctive treatment to levodopa-carbidopa in patients with Parkinson's disease, PD, experiencing OFF episodes. Important safety information. Contraindications. Ongentys is contraindicated in patients with concomitant use of non-selective monoamine oxidase, MEO inhibitors, pheochromocytoma, paraganglioma, or other catecholamine-secreting neoplasms. Warnings and precautions. Cardiovascular effects with concomitant use of drugs metabolized by catecholomethyltransferase, COMT. Possible arrhythmias, increased heart rate, and excessive changes in blood pressure may occur with concomitant use of Ongentys and drugs metabolized by COMT, regardless of the route of administration, including inhalation. Monitor patients treated concomitantly with Ongentys and drugs metabolized by COMT. Falling asleep during activities of daily living and somnolence. Patients treated with dopaminergic medications and medications that increase levodopa exposure, including Ongentys, have reported falling asleep while engaged in activities of daily living, including the operation of motor vehicles, which sometimes has resulted in accidents. If a patient develops daytime sleepiness or somnolence, consider discontinuing Ongentys or adjusting other dopaminergic or sedating medications, and advise patients to avoid driving and other potentially dangerous activities. Hypotension, syncope. Monitor patients for hypertension and advise patients about the risk for syncope. If these adverse reactions occur, consider discontinuing Ongentys or adjusting the dosage of other medications that can lower blood pressure. Dyskinesia. Ongentys potentiates the effects of levodopa, which may result in dyskinesia or exacerbate pre-existing dyskinesia. Reducing the patient's levodopa dosage or the dosage of another dopaminergic drug may reduce dyskinesia that occurs during treatment with Ongentys. Hallucinations and psychosis. Consider stopping Ongentys if hallucinations or psychotic-like behaviors occur. Patients with a major psychotic disorder should ordinarily not be treated with Ongentys. Impulse control, compulsive disorders. Patients may experience intense urges, for example, gambling, sexual, spending money, binge eating, and the inability to control them. It is important for prescribers to specifically ask patients or their caregivers about the development of new or increased urges, reevaluate the patient's current therapies for Parkinson's disease, and consider stopping Ongentys if a patient develops such urges while taking Ongentys. Withdrawal emergent hyperpyrexia and confusion, a symptom complex resembling neuroleptic malignant syndrome, elevated temperature, muscular rigidity, altered consciousness, and autonomic instability, has been reported in association with rapid dose reduction or withdrawal of drugs that increase central dopaminergic tone. There were no reports of neuroleptic malignant syndrome in Ongentys-controlled clinical studies. When discontinuing Ongentys, monitor patients and consider adjustment of other dopaminergic therapies as needed. Adverse reactions. The most common adverse reactions, incidence at least 4% and greater than placebo, were dyskinesia, constipation, blood creatine kinase increased, hypotension, syncope, and weight decreased. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Please see neurocrine.com/UngentysPI for full prescribing information.